Has been calling the health insurance industry villains for a year and a half. We get to an end of the process where the biggest winners in this entire process are the health insurance industry, who are going to make billions and billions of dollars off of Nancy Pelosi's vote. And as Anthony Weiner said before, and then we'll talk about the good parts of it. We were talking on the radio. This is the largest transfer of wealth from the middle class to any industry in U.S. history. There's no cost containment. There's no public option. There's no competition between states. There's nothing that holds down the cost. In fact, health insurance industry leaders after this bill will still be able to get on the phone, and because there's an antitrust exemption that only they in Major League Baseball have, and fix prices. Okay. They will still be able to fix prices unlike any other industry. Nancy Pelosi can say we're doing the moral thing because we're going to bring 31 million people under the insurance rolls, and I'll say, okay, we can debate about that. She can say we're going to extend the life of Medicare for 9 years. I say, okay, well, let's have a debate over that. She can say we're doing good things with Medicaid. I'd say let's have a debate about that. But any Democrat that comes on and says that this is a bad bill for the health insurance industry, I'm sorry, Susan, and this is where you need to send me an email. If they know what's going on, they are lying. They are deliberately lying to the American people, because the healthcare insurance industry is the huge, huge winner in this bill. The huge winner. And Nancy Pelosi, the same person who called them villains a year ago, is now saying, we're taking on the health insurance. No, you're not. You are making them richer. Well, Anthony Weiner,
well,
New York's 9th district congressman. No, I think Anthony might agree with me on this one.
I'm really conflicted here. I really don't know which way to go with this, because, as you know, I've argued to you that I don't think the health insurance industry has any legitimate role in this transaction.
And let me just say, at the end of this process, I'm moving just a little bit closer to where you are, Anthony, because this is despicable. Whoa. This is despicable.
We're going to get you on here more often. We're going to get you on here more often.
Whoa. True or false, the healthcare insurance industry is going to have a tremendous windfall from this bill.
Well, look, there's no doubt about it. When the president started this process by saying that we're not going to expand Medicare and single-payer systems, we're going to go with the other half, which is the for-profit insurance employer-based system, automatically right then we took a step, I think, in the wrong direction. But all of that being said, I really have to dispute the idea the health insurance industry is all that excited about this. A lot of their worst practices are going to have to stop doing as a result.
Okay, but let's first, I'll let you go talk about that part of it, but first, is it not true that this is the largest transfer of wealth to any industry in U.S. history?
Except for wartime.
Since World War II.
Except the military, things like that. You know, but the answer is yes, but look.
Okay.
But
now you can go ahead. I've made my point. I'm going to eat my grape nuts.
Here's the point. First of all, I think that you're right. To some degree, we're solving the problem, not having people go into emergency rooms without insurance, by giving them insurance, which is actually cheaper to give them the insurance than provide care in an efficient way. So that's true. We do hope, though, at the end of the day, that the CBO turns out to be right, that all of us wind up paying less, because insurance rates do come down, because we're going to aggregate them all in one exchange, and we're going to expand the pool. Right. But you're right. If we are hoping and praying that the insurance industry is going to start being good guys, that's not going to happen. But here's, I can tell you this for sure. Yeah. Every single of my Republican friends have every single day in this process gotten up and say, how can we protect the health insurance industry? And Democrats are doing something different. We're thinking about how we can reel in the worst abuses.
You're thinking, how can we make them rich? And you're doing a pretty good job.
First of all, don't point at me on that. I'm saying,
Joe is moving to your left. This is a historical moment. Joe Scarborough is to the left of Anthony Weiner.
Actually, Peggy, I really do, because I love the institution of Congress. I really do. I feel sorry for people like Anthony Weiner who have seen this process just perverted over the past year. It has been a horrific way to run Washington, D.C. This White House, it seems to me, they still don't know what's in the bill, according to your column.
They don't. Mrs. Pelosi even said a few weeks ago that we have to pass the bill to see what is in the bill. The president said to Bret Baier the other night, he said, well, you know, I'm going to know what's in that bill when we post it on the internet. I must say, the problem for Congress, you feel loyal to the institution, and you should. It is a great American institution and vitally important. We are a republic. That having been said, This was one of the most unpopular institutions in America before they went through this dreadful process
now, yeah.
with all of the buying of congressmen and the buying of senators, making it look so bad and sort of straining the system every day as they try to force this thing
Peggy,
that is not popular through the Congress.
What went wrong? Because you can go back, you can look at the columns, you can look at the hate mail that you got. For the first 3, 4, 5 months of Barack Obama's administration, you were cheering for him. You said this guy,
oh, absolutely, hoping this is going to go well.
Could be
we
different.
needed a successful president.
For you, what went wrong?
The president misunderstood his moment in history, and he misunderstood what history was asking of him. History had dictated a sentence. It said, we are in the Great Recession. You have to worry about debt and deficit. Don't be about spending. You have to be about how do we control this fact that China owns our paper and Japan owns our paper. There was that, and you have to keep us safe in the era of weapons of mass destruction. Nowhere in that sentence do we have the words fully insured, co-payee, insurance company. Do you know what I mean? It was fatally off point. I know that the president had talked about health care during the campaign, but it was only after his election and after his inauguration that the full implications of the financial moment we're in became clear and absorbed by the American people, who started losing their jobs.
So, Howard, let's go through this health bill quickly, because I certainly said what's wrong with the health care bill. I want to follow up with something I talked with Anthony on the radio, and that is, there are going to be 31 million people that have health insurance, but at the same time, eventually.
Right.
But we pay for those people now anyway when they walk into the emergency room at 11 o'clock at night with their children, because emergency rooms are primary health care providers for the poorest among us. That is obviously not an efficient way to do things. So explain to skeptics like myself why this will take care of that problem.
Look, this is not a perfect bill. I'm with Anthony on this bill. But the fact of the matter is that I disagree with Peggy fundamentally. Health insurance and jobs are absolutely coincident. And they're going to be people who, as of the day the president signs the bill, are not going to be eliminated from kicked off their health insurance anymore. That's a big deal. There's going to be people who are eligible for Medicaid who are working for a living but who don't have kids. That's a big deal. There are going to be states that get 90% match instead of 60 or 40% match. That's a big deal. So there are some things in this bill that make it worth passing. I would agree that it hadn't been handled very well. But I think the way to get this bill done would have been to do it the way George Bush would have done it. Have it on his desk, run it through reconciliation, stop fiddling around with my good man in the Senate and all this nonsense, and get the damn thing done. The House passed a good bill.
What about bipartisanship?
Oh, bipartisanship, my butt. The Republicans were never going to be bipartisan.
Anthony,
you are absolutely wrong. In the early days, they were open to it.
They were no interest. They had no interest in it at all.
They did.
Undermine the president.
So many of them came from districts that were very close or that Obama won.
And let's zoom in on Anthony. He is
you know,
just
I got to tell you, these are two of the most cliched hackney assessments of this thing. One, that this was not a good process. It went through 5 committees, the most open process I can imagine. Every single Republican amendment was considered. We all discussed it. We've discussed it on these shows. This is not a proud day for America. This is how process legislation works. Secondly, this idea that we are not losing jobs because 20% of every dollar we spend goes to health care is just wrong. All of our money isn't going into payroll now, it's going into health care. When a car plant closes in Michigan and moves to Canada because it's $7.25 more an hour to employ someone in Michigan, tell those workers that health care is not related to the economy. We are anti-competitive because of this health care problem. And to not realize that ignores even the Republicans at that table at the White House. We had to solve this problem if we were going to fix the economy.
Health care is related. Education is related.
Sure.
So many things are related. But look, we are in a great recession. You got to focus on that. You don't go on to the secondary and tertiary issues. You go on to the main and essential issues.
You've got to hire people,
you don't go
and you're
off
not
on this
going to
one-year tangent.
Would you stop one-year tangent? Healthcare is 20% of our economy, and it's a tangent. This is the problem. We've got to solve the problem, but let's do it some other time. For 8 years in this country, this problem was festering. Incomes were flat. Why? Because every single spare dollar an employer had to go into healthcare, not into wages. Our wages are down. Our economy is at a standstill because of healthcare. And we're fixing that problem because your team didn't do it.
You
Look,
were
wages
saying
have
that
been
our
stagnant
that our
for more than
economy,
8 years.
yeah.